Hello, I am Brenda Orazietti, and I am a nurse. I work as full-time faculty with York University. I am in the Faculty of Health Department of Nursing. A learning need for my nursing students has come to my attention recently, and that has to do with the role of the personal support worker, PSW. So I am here with an expert, my colleague and friend, Rivie Seaberg, and I'd like to formally introduce you to her now before we start this video segment called Mythbusters on PSWs. So Rivie is a former Director of Health Sciences Programs at George Brown College and a former Vice President of Baycrest Center for Geriatric Care. Rivie's career includes teaching, healthcare, and personal support in Ontario colleges and universities. From 2003 to 2005, Rivie has served as a project lead for the College of Nurses of Ontario on a baccalaureate entry to practice task group. In this capacity, she was instrumental in the adoption of new entry to practice requirements for RNs and RPNs. Rivie has served as a surveyor with the Accreditation Canada and currently serves as a surveyor with PEPA, the provincial program accrediting personal support worker programs offering Ministry of Health personal support worker curriculum. In this capacity, Rivie is responsible for measuring compliance with standards that define PSW educational preparation. Rivie has been an active participant in the development of new standards of practice for personal support workers and has and continues to work with organizations to assist them to integrate PSWs in their skill mix. Rivie obtained her master's degree in public management from the University of Alberta and her baccalaureate degree from McGill University. She also holds diplomas in dispute resolution and long-term care. Rivie's research interests include the effect of environment on the ability of PSWs to work to full scope of practice and identification of factors that encourage collaboration between regulated and non-regulated care providers. So I've had the pleasure of this semester to teach Leadership and Change, course 3514, with Rivie this term. So welcome, Rivie, and thank you so much for doing this segment for our nursing students.
Thank you, Brenda.
So Mythbuster number 1 is PSWs are regulated and have a registry.
So that's not true, actually. PSWs are not regulated. And I believe it was in 2005, the Minister of Health asked for a review of PSW scope of practice, looking at whether or not it should be regulated. And the response that came back to the minister indicated that the scope of practice of PSWs did not qualify for regulation. There's some confusion that the provincial registry is a component of regulation of PSWs, but in fact it's a misnomer. The provincial registry is in fact a public list that includes the names of individuals who have certificates as PSWs and also individuals who provide personal care. So I think all of that contributes to this misunderstanding that PSWs are in fact regulated, which in fact they're not.
That is so helpful, that information.
Good.
Thanks for clarifying that. Myth number 2, PSWs determine their own scope of practice.
So this too is not correct. PSWs work within the confines of legislation, employment, responsibilities, policies, and procedures, and they're responsible to clients and the client's family caregivers, as well as these employing agencies or facility and the professionals with whom they work in these agencies or organizations or facilities. The PSW scope of practice is reflected in legislation that affects the work settings that PSWs will work in, such as the Long-Term Care Homes Act. The Long-Term Care Homes Act defines who can work as a PSW in a long-term care facility and what their roles and responsibilities are.
Thank you for clarifying that. Myth number 3, the majority of hours of service that PSWs provide is not much, not very large.
Well, as far as Mythbusters is concerned, this is a biggie because, in fact, if one takes a look at a study that was done in 2010, the estimated hours of PSW service was in excess of, you ready for this? 78 million hours divided up among long-term care, home care, and community support.
So they do a lot of hours.
They do an awful lot of hours, and that same year it was estimated that there were approximately 25,000 PSWs working in home and community care, 47,000 working in long-term care, and this I found extremely interesting, approximately 5,000 working in hospitals, which is not typically a setting that you would think that you would find non-regulated care providers. PSWs make up the largest component of healthcare providers in the province of Ontario, and like nursing, the average age of PSWs is approximately 46 years old. And so like nursing, the same issue of supply, because so many of the individuals currently providing services, PSWs, are going to retire eventually, and sooner than later, I think we're going to be looking at a shortage of PSWs as well. And when you look at it in combination with nursing shortages, we've got real issues to contend with.
It's interesting, the parallel.
Yes,
with the average age of the nurse being around the same age, and then having the same probably musculoskeletal strain injuries.
Definitely, definitely.
And so similar to nursing, they have a large component of practicum that they have to demonstrate before they can get their certificate.
Definitely, it's part of their educational program.
Now, I'm an acute care nurse, and all the practice settings that I've been exposed to, whether I'm teaching as a CI, there's PSWs employed throughout most units in most acute care facilities.
Yes.
That's what I see. They're prevalent in almost every area of healthcare.
And have you seen an increase? Do you see
Yes,
see
I
more
see an
and more?
increase,
Yeah.
yes, due to the workload and the demands of the job.
Yeah.
Yes, I see an increase, which is wonderful. They're a wonderful member of the healthcare team.
I'm delighted to hear you say that, Brenda.
Myth number 4, only people who graduate from PSW program can work as a PSW.
So that's not true, and you probably surmised from what we were talking about earlier that in order to provide personal care, if you wish to provide personal care, then certainly if you hold a certificate as a personal support worker, you have the knowledge and skill to be able to provide personal care, and you'll be hired as a PSW, but you don't necessarily need that certificate to put yourself forward as someone who will do personal care. As I said earlier, in long-term care you must have a certificate, but there are many, many other places where individuals without formal training provide personal care, which is a concern.
So they can get their education at a community college. In the GTA, there's probably several schools that offer the program.
There are, I believe, there are 43, if I'm not mistaken, community colleges in the province of Ontario.
Oh, that's a lot of courses that offer the
yes,
program.
Yes, you're quite right, because virtually all of the community colleges have a PSW program, either part-time or full-time during the day, in the evening. In addition to community colleges, you can study to be a PSW. Some of the school boards have adult education divisions, and in the adult education division you'll find PSW programs, and there is a plethora of private career colleges that also offer PSW programs.
Can we just talk about how long the program would be at a community college, for example?
Yeah.
What's the
Yeah.
typical length of a full-time program?
So the typical length would be, if we're talking about it in terms of semesters, it's usually 2 semesters. It's anywhere from 500 to 700 hours. The average is probably about 650 hours. And the program consists of not only theory, but also they have an opportunity to practice skills in a skills lab, and they also do practicums. They do practicums in long-term care and in the community. And the topics are virtually similar, and you'll understand that the complexity and the depth and the breadth of knowledge of the courses that they take is certainly not as extensive as it is in nursing, but they touch on things like the ethics of healthcare, ongoing conditions, pharmacology, things that have to do with personal protective equipment, infection control, all of the things that have to do with the fact that they provide personal care. And in addition to that, there are courses that have to do with the instrumental responsibilities they have, such as meal planning, light housekeeping, how you manage the home, recreational and social activities, palliative care, you name it. There's a subject or a topic that's part and parcel of what goes into the PSW educational program.
That's very helpful. Can we just touch on the difference between if I were to go to a private facility, a private school, to take my course, what the difference would be?
So I just want to back up a little bit and let people know that there are different curriculi that PSW programs are based on. There are certain curriculi that, if they are accredited by certain provincial accrediting bodies, qualify for the Graduate to Work in Long-Term Care. Private career colleges do not all provide that particular curriculum. There are a large number of private career colleges, and I think there are more private career colleges than community college and boards of education and any other form of organization that provides PSW programs. Virtually, there are just more private career colleges that offer PSW programs. And many of those programs do, in fact, provide the number of hours that is required, but there's also a large number that provide those hours in a compressed form, so it's an accelerated delivery of it, or in many instances the depth and breadth and subjects that are included are not in keeping with what the Ministries of Health and Long-Term Care and the Ministry of Education and the Ministry of Training Colleges and Universities require PSW programs to be. So I think it's important for all of us, certainly regulated healthcare providers, and those of us who are in employment situations, to recognize that a PSW program is not a PSW program, is not a PSW program, and you have to be very aware of what the competencies that the curriculum is based on is all about.
That's very important for us to know as our young nurses bloom and grow into become nurse managers and higher. And that'll be something they need to know in the future.
Right on, exactly.
Right?
Exactly, yeah.
Mythbuster number 5. PSWs earn a PSW diploma at the end of their training.
So, while there are some private career colleges that advertise that they grant a diploma as a personal support worker, that is not the case. The curriculum, when you look at it, does not qualify for diploma in accordance with the credentialing standards in this province, and the PSW earns a certificate, which is one level lower than a diploma.
Thank you for clarifying that. Mythbuster number 6. PSWs only work with the elderly.
Now that's a very common belief. It's not only a belief that the public hold, especially the elderly who hire individuals to help them with personal care, but with individuals who are contemplating a career as a personal support worker. More often than not, in the class with PSWs, you'll hear a PSW respond when you ask him or her, what is it about personal support work that has attracted you to be here? He or she will say, I took care of my grandmother, I love the elderly, people over 80 are very interesting and I want to help them. But in fact, PSWs work with individuals from birth to grave.
Just like nurses.
Exactly.
All
just
ages,
like nurses.
the whole age span.
Exactly.
Wonderful. Mythbuster number 7. PSWs are mini nurses.
Another very common misunderstanding. There are basically two schools of thought when it comes to thinking about PSWs. One school of thought is that PSWs belong to the family of nursing and they're mini nurses. There's another school of thought that says that's not true. PSWs are really social service workers and they belong to that particular category of worker. In fact, in Ontario, PSWs are considered to belong to a unique category of worker. And their role is to do for an individual whatever he or she would do if he or she were cognitively and or physically able to do those things. And the range of services provided by PSWs is congruent with that particular definition. So if you categorize the services that PSWs are providing, they fall into 2 or 3 general categories. One has to do with personal care, especially activities of daily living, such as grooming, bathing, dressing, oral care, things that have to do with preparing your physical self and your psychological self for the day.
Toileting to the washroom.
Definitely
changing a
toileting.
brief.
Yes, definitely. Yeah, mobility. If I have difficulty with mobility, a PSW would help me get from A to B, transfer from my bed to my scooter or my walker or my wheelchair, those kinds of things. And then there's a large component of the PSW scope of practice that is usually referred to as instrumental tasks. And those have to do with the kinds of things that I talked about earlier: meal planning, budgeting, managing household matters, identifying what kind of food needs to be purchased, if there are issues related to financial matters, with the permission of the client and being congruent with and adhering to particular policies and procedures that have to do with fiduciary responsibilities, then the PSW would get involved in those kinds of things as well.
So it wouldn't be to the extent of shoveling my driveway and cutting my lawn and weeding my garden.
No.
That does not fall within the PSW role, correct?
No. It goes back to what I said earlier. It has to do with doing things that if I'm not capable of doing them for myself, and that have to do with getting on with my life, the PSW would be engaged in those activities.
And it's just light housekeeping
Correct.
versus scrub my walls and paint my walls.
Right. I don't do windows.
They don't do windows. They don't do windows,
No.
right?
No.
So let's say a new mother came home from the hospital and had a C-section and maybe a difficult vag birth and had a PSW in the home.
Yeah.
How would that role play out? What sort of responsibilities would the PSW take on?
Excellent example, Brenda. The PSW would most likely, now here too it would depend on what the mother wished the PSW to be engaged in. Let's say that mother with the newborn and the difficult delivery had 2 toddlers at home as well. The PSW would take on responsibility for preparing the children for daycare, let's say, or keeping them occupied, or making sure that they ate or were dressed properly or bathed, and giving the mother an opportunity to rest. So the PSW might make sure that the baby is fine, but most likely would concentrate on other matters related to keeping the environment peaceful for the mother and the babes.
That's nice. That's a good example. Now, what about someone who has Alzheimer's and has social or recreational activities? How would the PSW role fit in there?
Would fit in very, very well. Many of the clients of PSWs, either in the community or residents of long-term care homes, suffer from Alzheimer's disease or other cognitive impairment processes. And let's say that the individual was attending a day program for people suffering from Alzheimer's disease. The PSW would accompany that individual and would assist the individual to participate in the activities that are going on, perhaps assisting the PSW, the client to read, for example, if the activity was reading a journal or a book, or playing bingo, if it was a recreational program, then the PSW would assist the resident to actually play bingo, help him or her identify the numbers, help him call out "Yay, bingo!" if he or she won.
That's
help him
wonderful.
with the cards, those kinds of things. Yeah.
That's great. Thank you for clarifying that. Myth number 8, PSWs are not allowed to perform controlled acts.
Okay. So, not true. And just as a reminder, controlled acts are acts that require regulated healthcare providers to do invasive procedures. And the belief is that only regulated care providers are engaged in activities that constitute controlled acts. In fact, that's not the case. If the client of the PSW requires the carrying out of a controlled act as part of his activity of daily living. Let's say catheterizations. Let's say the individual has multiple sclerosis and requires Q6 hour intake and output of urinary function, clean procedures usually. Then the PSW is able to carry that out. There are certain criteria that need to be met in order for the PSW to be able to carry that out, and the regulated care provider and the PSW both have responsibilities related to that controlled act. Mm-hmm. And I'll be happy to go into that in more detail if that's of any.
Oh, please do, yes. Please explain the conditions that must be met.
Okay. So first of all, the need for that particular controlled act is there because it's an activity of daily living. If the act was not able to be accomplished, then it would interfere with the individual's ability to get on with his life.
So it's routine, a routine care matter.
Correct, exactly, exactly. The individual has to be stable. The particular activity has to be something that's been going on for a long time. The PSW needs to be trained in carrying out this particular procedure for this particular client. These teaching procedures are not transferable. Once I've been taught, it doesn't mean that I can do it for anybody who comes along and requires it. It has to be taught each time a client requires this particular controlled act. The PSW, I think I may have mentioned it already, needs to know where to get help if he or she needs that kind of assistance. Mm-hmm. It's up to the PSW to make sure that he or she feels confident being able to carry out this controlled act. And for the registered staff, the RN or the RPN, and the College of Nurses of Ontario has an excellent guidelines for working with unregulated care providers, and I think all students, nursing students, need to be familiar with that particular document, because the responsibility for determining if that controlled act should be delegated to the PSW is the responsibility of the regulated staff. And the regulated staff, as I mentioned before, is responsible for ensuring that the PSW can carry out the controlled act for, on a regular basis, evaluating that activity is something that the PSW can do, and all of the supports that go into making sure that this procedure is safely done by the PSW, him or herself.
Excellent. Now let's say the same client who's in their home with multiple sclerosis, who has a clean in-out catheterization procedure done, develops a pneumonia and has to be transferred to an acute care hospital. Does the PSW continue to do the controlled act of the INO? How does it differ, the application of controlled acts, from one setting to the next?
Right on. So you will no doubt wish the students to understand that when someone is transferred to the hospital, it's usually because the person's condition is unstable. And so that, from the get-go, determines that the PSW would not be involved with the controlled act because of the condition of the client. And in hospitals, you will not see PSWs engaged in carrying out controlled acts for that reason.
Very true. Thanks for highlighting that for us. Those are very important points. Myth number 9, it is up to the PSW to let the RN know if she or he has the knowledge and skills to carry out the controlled act.
Yes, and my answer to that is yes and no, or sort of yes and sort of no. It's really, this is an excellent example of collaboration between a regulated care provider and a non-regulated care provider. It's up to the PSW, certainly, to advise the individual who has delegated the controlled act to know that he or she is accepting that, and if he or she has any concerns that the competence that's required, the competencies that are required to carry out these acts are not present, or he or she feels shaky, then there's only one answer: I'm sorry, I'm not prepared to take on this responsibility. But it's also the responsibility of the RN or whoever's delegating that controlled act to determine if the act should be delegated in the first place, and if the person to whom it's being delegated is an appropriate individual for all of the reasons that I've cited earlier.
That makes sense. That's right. So in the long-term care setting, it's quite common for the PSW to have the delegation of controlled acts related to suppository, giving a suppository or an enema, or medications with creams, but that's not a controlled act.
Correct.
Right. That's a skill.
That typically
it's not controlled.
That's right.
Right.
Yeah.
Right.
Yeah, because it's not invasive.
It's not invasive.
Yeah.
Right.
Yeah.
Right. And thank you for clarifying again. Myth number 10, PSWs cannot give insulin injections.
Okay, so giving an insulin injection is a controlled act. It also involves medication, so it's an excellent example to ask about. PSWs, under certain conditions, and by now hopefully the students understand what those conditions are. The individual has to be stable, it has to be an activity of daily living. The PSW needs to know how to do this for this particular individual. The individual who is delegating this responsibility is confident that the person to whom he or she is delegating it has all the knowledge and skills to be able to do this. If all of these things are present and we're talking about this taking place in the community, such as in the individual's own home, then PSWs can certainly give medications such as insulin by injection.
And they give medications quite a bit, which is our next myth,
Yes,
right?
yes.
So myth number 11, PSWs cannot give medications.
Right. So typically when we're talking about medications, we're really not talking about controlled acts. But medications and PSWs, there's a lot of controversy here too as to whether they should go together. And in fact, in the community, PSWs are definitely engaged in giving medications with all the trappings of medication administering or assisting, including signing off on a MAR sheet, making sure that they check the labels, ensuring that they're familiar with the side effects of the medication, that they observe for any untoward effects as a result of the medication, that they know what to do with that, and that there's a predictability as far as what the PSW expects the medication is going to do for the client.
So in the community, it's safe to say it's mainly PO, PROS meds,
Correct.
and perhaps insulin versus anything else.
Correct.
Nothing
Correct.
else invasive. They're not hooking up Hickman lines or PICC lines and giving IV meds or
No,
anything to
no,
that extent.
no.
It's mainly pouring the regularly scheduled meds and helping them. They place the pill in their mouth and
Right.
assist them with water to take the
Correct,
pill,
correct.
and then sign the MAR.
Correct. Well, it's as we said
Yeah.
earlier, it's doing for the client what the client would do by himself, for himself, if he was able to do it.
Right, right. So that's the community, right?
Yeah.
Right. Anything else we need to discuss?
I just want to stress one thing, that it's highly unlikely that the use of PSWs is going to decrease with the baby boomer move and just all of the things that are happening in healthcare. I think it's important to recognize that we have colleagues, that nurses have many colleagues who are involved in providing healthcare services, and personal support workers are an extremely important partner. And if we're talking about leadership on the part of registered nurses, it's very important to recognize that there's a responsibility to include collaborative practice of PSWs in the practice of registered nurses.
Oh, I couldn't agree more. That's so well said. Thank you so much, Rivie,
Very
for your
welcome.
expertise and your time, and I'm sure our nursing students will be very enlightened from this video clip.
Thank you very much.
Thanks and enjoy.